A warm good evening to one and all present over here. I welcome you all to PRAGNAVARIDHI lecture series conducted for second year BAMS students. Before commencing with the session, I would like to give a small introduction on Panchajanya. Panchajanya, the divine conch of Bhagwan Sri Krishna, which was blown during the Kurukshetra, indicating the start of the Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motive in our minds, our organization will work towards establishing the importance and necessity of following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda, not only as a treatment modality, but also as a way of life. All this while walking in the path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. With this aim in our mind, I would like to welcome you all to Pragna Varadhi lecture series conducted for second year students. Today we have with us Vaidya Mangalam Vani. Mom is currently working as an assistant professor in the Department of Roga Nidana in Alva's Ayurvedic Medical College. Mom has completed her UG and PG in the same institution. She has a total of 4 years of working experience and she has done her dissertation on the title An Observational Study on Etiology and Pathogenesis of Pittaja Mutrakrichra. Ma'am has presented 6+ research papers at various national and international Ayurveda seminars and has attended 8+ workshops and seminars focused on Ayurveda and traditional medicine. Ma'am has published an article in the international and national Ayurvedic medical journals. She has taken in charge of various national and international seminars like Tejas 2022, Gnana Chakshu on 2023, organized by Alras Ayurvedic Medical College. She has an experience in handling and organizing various national and international seminars and programs. We welcome you, ma'am, handing over the session to you.
Thank you, Sai Prabha. Thank you for this opportunity. And about, before going to the topic, as you all know about the importance of the topic, it is a must-to-know topic and related with. I hope it is clear with that slide.
Yes, ma'am, it's clear.
So Mutrakrichra, as we all know, it is related with the Mutra and Krichra. So as in the figure, you can see the difficulty or Krichra, how the patient feels. That can be elicited by the name itself. And before going to the topic, I can clearly explain the importance of this topic for exam point of view because it is a must-to-know topic, and you have to without studying this topic you can't enter for the exams because the main reason is, as you have seen in like what will be the topic which will be coming under MCQ and short essay and long essay. So in this topic Mutrakrichra mainly it covers MCQ and short essay, and as in the slide you can see long essays it won't be asking, but in the short essays and MCQ it is it will be covered in the question papers. So, before moving on to the exact disease, we will be revising the first year topic like Mutravaha Sroto Moola and all. We have studied that. In according to Acharya Charaka's opinion, it is Basti and Vangshana, but according to Acharya Susruta, it is Basti and Medra. So that difference of opinion can be noted down for the purpose of MCQ. In MCQ, it can be asked like according to Acharya Charaka, whether Medra is included or Vangshana. So that vice versa question can be expected. And Mutravaha Sroda Moola, you have studied Mutravaha Sroda Sa, Bastir Moola, Vangshanocha. In according to Susruda also you can study that. So these are the must to know topics, and these slogas you can revise it also in from the first year syllabus. And coming to the Nidanas, we have studied all the Srodova Nidanas, right? So in that Mutravaha Nidana includes mainly like intake of drinks and foods like which um, during the urge, when the patient is about to have urge of the micturition, if he is having any food or drinks, and also including sex or any intercourse during the urge of micturition, so they are doing the vega nigraha, then doing intake of food and water and all the other like suppress vega dharana is one of the nidana, and suppression of the micturition also, like mutra nigraha is also told here. So mutra nigraha is also told here, that is also important. And injury is also one of the nidana, and this is from charaka vimana. In vimana sthana 5th chapter they have included the nidana and srotomula, but the vidya lakshana which we have studied in the first paper, you need to study the vidya lakshanas of each srotas. In that mutravaha srota vidya lakshanas, in that they have included like basti, like stiffness of the bladder. So after obstruction of the urine and water, there will be having stabda metrada also, stiffness and numbness in the penis region, stabda metrada cha. So the vidya lakshana which you will be studying in the first paper is also important. And what are the diseases which you can consider under mutravah srotas? Prameha, Mutrakrichra, Mutraghata, Ashmari, Kamala, Jwara, and even Pandu also can be considered under Mutravaha Sroto Vigara. So, in that main disease is Mutrakrichra that we will be covering in this class. So moving on to Mutravaha Srodha Dushti Lakshana. This also you have to study in the first paper. In the first paper, mainly it concentrate about the Moola, then Nidana and Vidya Lakshana, along with the features like Lakshana, important Lakshana, when if what the Srodhas is affected or not, we will be coming to know if the patient shows such symptoms. Like what? Adisrishta, Adibadda, Pragopida, Alpalpa, Bahala, Sashula. So these are the some of the important symptoms that we will come to know that it is affected, that Mutravas Rodhas is affected. Frequent passage of the urine and reduced quantity of the urine, passage of the urine, Adibadda and Pragopida. So here that color variation can be considered, like if it is yellowish, that also can be considered there is a pragubita dosha, and even whitish, and even some of the influence of some of the bacteria or congenital disease also, like black colored urine etc., can be we can do anumana pramana that there is a dushana of mutravaha srodhas and alpa alpa bahala sashula. So these are the mutravaha srodho dushti lakshana which you will be studying in the first paper of Roga Nidana. Moving on to the disease exactly. Mutrakrichra. It is one among the Mutravah Srodhavihara, which I have just explained prior. And in Acharya Charaka, according to Acharya Charaka, in Chikitsa Sthana, 26th chapter, Trimarmiya Chikitsa Sthana, you will get the reference. And in Susruda Uttaratandra, Mutrakrichra Pradisheda is explained in the 59th chapter. And in Madhavakara, 30th chapter, you will get the reference. Moving on to so before going to this, you need to see your exact syllabus. So what are the things you need to highlight? Like here, see Pratyatma Lakshana of the Mutrakrichra. First point. Then we will be studying about the Hedu Samprapti of Mutrakrichra. Then enlist Vedas of Mutrakrichra and describe Vishishta Lakshanas of Mutrakrichra. Mind you, it is all our MK, must to know topic. So everything you need to study, including the slogas. So, Mutrakrichra Pratyatma Lakshana you will get in Madhukosha Vyakya. Mutrakrichranidi Mutrasya Krichrena Mahada Dukkena Pravarti. So, as in the first slide, I have shown that figure, right? So, that patient, how he will be showing, he will be expressing his difficulty in passing the urine, Dukkena Pravarti will be expressed by the patient. So that is the Pratyatma Lakshana. The main Lakshana which is expressed by the patient, Rogi, is known as Pratyatma Lakshana. Mutrakrichra iti Mutrasya Krichrena Mahada Dukkena Pravarti. Madhukosha Vyakya, you will get the reference. This is the Pratyatma Lakshana. Moving on to Hedu of Mutrakrichra. Hedu of Mutrakrichra, mainly we can consider all the excess activities like Vyayama. Vyayama, if we do in excess, what happens? So likewise, Vyayama, Tikshna, Aushada, Ruksha Madhya, Prasanga Nitya, Drida Prishtayanat, Anuba, Mamsa, Adyashana, Ajirna, Syu, Mutrakrichrani, Mrina, Tada Ashtav. So you have to consider excessive physical. So the word excessive should be considered here. Okay, excessive physical exercise, conception of all the Tikshna Aushadas. Tikshna Aushadas, you can consider all the like not even complaining about certain medications, but even if you have taken more of the modern medicines, after the even though the patient get relieved, but he may have end up with like gastritis or some sort of irritation in the oral mucosa from mouth to anal region. So those tikshna aushadas can be considered in that category. And like ruksha, obviously ruksha, madhyam and food also is to be considered, and regular intake of madhyam, ruksha, madhya and prasanga nitya, druta prishtayana. So even intercourse and riding in some of the, so nowadays you can consider in riding over the bike or something for a long time. So as I already told, the word excessive to be considered in the prior first list only. Excessive doing of vyayama, excessive taking of tikshna aushada, excessive taking of ruksha madhya, and daily indulging of intercourse, and druta prishtayana, continuous going or wandering in, like like prior they were telling about the horse or riding over the fast moving animals, but nowadays you can consider to that of bikes or any sort of such vehicles. And coming to the ahara, especially he have quoted anuba mamsa, and if he is taking adyashana, again the word excessive, excess you can consider, and ajirna, before getting digestion of the previous food, thus causing the su Mutrakrichra nrinam, thus causing the Mutrakrichra, the disease, to the human beings. Nrinam, human beings. Tada Ashtav, that are 8 types. So in the Hedu itself, Sankhya Samprapti is told. Tada Ashtav, 8 types of Mutrakrichra is there. So this sloga is very important. Vyayama, Tikshna Aushada, Ruksha Madhya, Prasanga Nitya, Druta Prishtayana, Anuba, Mamsa, Adyashana, Ajirna, Syut Mutrakrichani, Rina, Tada Ashtav. Reference is from, as I already told, Charaga Chikitsa, 26th chapter, Trimarmiya Chikitsa. Moving on to Samprapti. Samprapti, Pradak Malaha Swai Kubida Nidane Sarve Adava Kopa Mubeti Basta. So we have discussed those type of Nidana which is causing the disease. So what happens after the indulging in the etiological factors? Sorry, so the doshas get vitiated separately by the respective causes. So in the nidana you can see there is like it is not only like related to only vada, so separately also it can be it can cause to the Mutrakrichra, their respective causes to respective dosha, and thus at last it is localizing to the basti. So I will show the flow chart in the upcoming slide, so that see in this here adivyayama, adivyayama, adimaiduna, mutravegadharana, nitya druda prishtayana. So these are the mainly Vada Pragoba, right? Aggravation of Vada. Similarly, Aharas, some of the Aharas which will vitiate the Pitta, some of the things, Adyashana, Jirna, etc., can lead to Kapha dosha. So, actually, this vitiation of Tridosha and Agnimandya can lead to doshas in Basti. When all these Tridosha and Agnimandya reaches the Basti, they causes the Mutravaha Srodho Dushti, leading to Mutrakrichra. So I hope Nidana and Samprapti is clear. So moving on to the next point in your syllabus is Veda. Veda Sankhya Samprapti is 8 types. In the Nidana Hedu itself it is told clearly. Syu, Mutra Krutsrani, Nrana, Iha Ashtav. It is from Charaga Chikitsa. Charaga Chikitsa, they told 8 types. So what are those? Vada, Pitta, Kapha, Sannipadaja, Ashmerija, Sharkaraja, Shukra, and Shonida. So you need to have a clear cut clarification regarding who told Shukraja and who told Purishaja. Shonida and Abhigadaja somewhat, even though the main heading wording is different, the symptoms you can consider for Shonida and Abhigadaja as an injury or traumatic way you can see the symptoms. But in Shukraja and Purishaja, exactly the different aspect is told, and you need to study the Purishaja of Susruda's opinion in detail that we will be discussing later. So here you see Ashmeri is told by both of the Acharya, Sharkaraja and Shonidaja and Abhigadaja. Only words are different. But the Shukra and Purisha concept, two different name are told by Acharya Charaka and Susruta. This is some of the modern correlation you can. It is not mandatory that word to word correlation is needed, but for easy understanding you can consider this as a opinion of like Vada is neurogenic or traumatic, and Pitta comes under acute UTI, and Kapha as subacute, Sannibadaja is chronic UTI, and Ashmerija or Sharkaraja is urinary calculi, Purishaja is constipational dysuria, and Shukraja is stagnation of semen, and Shonidaja is again traumatic. You can consider. Moving on to individual, more like lakshanas of Mutrakrichra. First one as Vadaja Mutrakrichra. Tivra Rujo Vangshana. This is reference from Charaka Chikitsa, 26th chapter. Even in Susruta Uttara, 59th chapter, you will get the reference. But I feel this will be easy for you. Tivra Ruja Vangshana Bastir Medra Swalpa Muhur Mutrayadiha Vadat. So mainly what we know about the Vadaja features. Tivra Ruja. So considering the Ruja, you can like Tivra Ruja will be there in Vadaja Mutra Krishna, and only Swalpa. So the word Swalpa you need to consider for Vada. Elimination of only little quantity of the urine and often. So you see, even though it is very less quantity, but the frequency will be more. Muhur Mutrayadiha Vadat. So he will feel to pass the urine, but only a little quantity will be voided at that time of passing the urine. So this word swalpam muhur mutrayadiha increased urge of urination, but only little quantity will be there. Moving on to Pittaja Mutra Kruchra. Pidam, Saraktam, Sarujam, Sadaham, Kruchran Mutrayadiha Pittat. So here Pittaja Mutra Kruchra, mainly as we already told about Vada, mainly concentrating about the Tivra Ruja, etc. So Pidam, Saraktam, Sarujam. So here along with Ruja, they have given more importance to the color. Pita, Sarakta, and Daha. Obviously, we know it is related with the Pittaja. Krichran, Mutra, Mutra Adiha, Pitta. So it is these are the features related to Pittaja Mutra Krichra. Moving on to Kafaja Mutrakrichra, Basti Salingasya Gurutva Shodho Mutra Sapicham Kafan Mutra Kritra. So in here in Kafaja Mutra Kritra, they have told about the even though the quantity or the quality is mentioned here. So here unctuous or pizza and white, little warm like Guru Shwata and Salingasya Gurutva Shodho Mutram Sapicca. Here the quality of the urine is explained, and sliminess can be considered in the Kafaja Mutra Krishna specifically. Moving on to Sannipadaja. Sarvani Rubani to Sannipadat Bhavanti. So all those features in a combination, if a patient is telling to you, you can consider it as under Sannipadaja Mutra Krishna. It is Krishna Tamam Hi Krishna. So among these, this Sannipadaja Mutra Krishna is Krishna Tamam among these Mutra Krishna. Sorry. Moving on to special types of Mutrakritra. As I already told, these Vedas is important. Like Vadaja, Pittaja, Kafaja, Sannipadaja, you need to know some of the difference as that we can understand with the some of the features like Tivra Ruja in case of Pitta, Pida, Sarakta, Sadaha, and in case of Kafaja, the quality, Pichila, etc. Sannibadaja, it is the combination of all. But in special cases like Ashmerija, Sharkaraja, Shukraja, and Shonidaja, according to Charaga, and Purishaja, according to Susruda, you need to give a special consideration in differentiating the next four. So that we will be discussing now. Moving on to Shukraja. Who told Shukraja? Acharya Charaga told Shukraja. So here, like hold, even though the sloga is very important, I have highlighted the two important first sloga, first line and last line, because the patient will be telling these clinical features. This you can expect the patient to tell. So Rede Abhigada Abhihadasya Pumsa Pravartade Yasya tu Mutra Krusram. So here Pumsa. So you can expect these Shukraja Mutra Krusra like from a male patient. So characterized by pain in the groin, urinary bladder and penis. Syat Vangshana Basti Medra. See here characterized by Syat Vangshana Basti Medra Tasya Adishulam Vrishana Adivritta. So here the testicles become enlarged and painful. So the exact word pain, where the pain will be pain in the groin. Vangshana, Basti, Medra. So these are the main three areas which the patient will be telling about the clinical features, and even the testicles become enlarged. So Vrishana Adi Vritte. So it will be enlargement of the Vrishana will be there due to obstruction. So Shukrena Samruddhya. So there will be obstruction of urine due to the accumulation of the semen in the urinary tract. There will be obstruction in the urinary flow. Thus it will be a very difficult situation for the patient, giving the kruchrada and the stiffness of the testicles, because there is no flow of the urine, because the stagnant semen also will be there. Thus stiffness of the testicles will be there. And like all the malas are located in the urinary bladder. If at all any obstruction causes, so it will be affecting the associated organs, like if as even though it is semen is causing the obstruction, urine outflow is also affected, thus causing penis and urinary bladder to a condition known as stiffness or difficulty in maturation. And it can be correlated, or you can consider this case as spermatouria, and because there will be presence of sperm in the urine. So when we give for a urine analysis or a routine urine analysis, what are the things it will come under routine urine analysis? Mainly physical, chemical and microscopical. So physical and all, you will be getting all those color, frothiness and specific gravity, so such things. And biochemical, in that you will get bile pigment, bile salt and ketone body, sugar, albumin, such things. And moving on to the microscopy, you will get the pus cells, epithelial cells and crystals, cast, etc. So in that you will be using a centrifuged urine sample, so that the sediments you will be taking in a glass slide, you will see under microscope. So in that, if you see sperms in the urine, you can consider it under spermatouria. So spermatouria condition can be considered for Shukraja Mutrakrichra. So this is some of the slide you will be seeing. See here, even though it is a urine sample, here you can see sperm. Here also, see tail of the sperm here also. So such things you will be getting while seeing the urine microscopy. Moving on to Shadaja Mutrakrichra. Shadaja Mutrakrichra and Abhigadaja Mutrakrichra, like some of the symptoms are same. So we will be discussing Acharya Charaka's point of Shadaja Mutrakrichra only. In that, Kshada, Abhigada, Kshadajam, Kshayadva, Pragopidam, Bastigadam, Vibaddam. So here mainly external injury or traumatic injury leading to urolithiasis can be considered. So what happens here mainly, as in the previous case, there is a obstruction of urine outflow with sperm. Similarly here, due to the Kshada and Abhigada, there is a traumatic injury to the tract leading to distension of the abdomen, leading to obstruction of passing of the urine. So here blood instead of sperm, here blood in the urinary bladder get vitiated here, and thus causing the obstruction and pain. Here pain is also Tivra Artima Mutrena. Tivra Arti Mutrena, here that word can be highlighted. Tivra Arti Mutrena, like ashmeri type of pain will be there, and excessively accumulated. So here blood is accumulated due to the injury, vitiated blood, and that forms like calculus in the urine, leading to the distension of abdomen, atmadadam. So here distension of the abdomen and heaviness of the urinary bladder can be felt by the patient. So the patient will be telling, obviously after this trauma, some of the cases like abdominal distension will be there, so that you can think about the abdominal bleeding, internal bleeding will be there if the patient is having abdominal distension. Same concept can be considered here, atma datam. So distension of the abdomen, traumatic, there is a bleeding in the urinary tract, and the blood is vitiated here, so that it causes obstruction. And if you remove that obstruction, baster lagutvam cha vinisrade asmin. So the if it will be relieved when that obstruction is removed. So you can consider it under nephrolithiasis or urolithiasis, kidney stone, but you can consider more to a traumatic aspect than to a lithiasis, because it has given any other name like Ashmerija Mutrakrichra, but that Baster Lagutvam cha Vinismride Asmin can be considered when the patient will be having relief of pain if they relieve that calculus, if the calculus is passes out. They are like a hard deposit of mineral and acid salt stick together, because the presence of blood, it can be you like that blood will be helping them to sticking the mineral, acid, salt, etc., so that it will form a calculi like thing, causing the obstruction. Major complications of urolithiasis: acute renal failure, anuria, UTI, and renal obstruction, finally leading to sepsis conditions. So these are the red blood cells in the urine microscopy. So these like pearly things, no? So you will see those things in a urine microscopy. You can consider. So how will you interpret a urine report in that? These many cells, like 8 to 10 cells RBC per high power field, HPF. If you have seen some of the reports, you can see like that, like 8 to 10 cells per HPF, high power field. So these, you keep in mind, these are the red blood cells, which indicative of trauma or injury, leading to the presence of blood in the urine. Moving on to Ashmerija Mutrakrichra. Ashmerija Mutrakrichra, actually it is a very important concept, because even though in your syllabus Mutrakrichra, Mutragada, common urinary tract, urinary diseases is explained, they have not clearly mentioned about Ashmeri as a disease. But you need to study that Ashmeri disease under Ashmerija Mutrakrichra itself. But in Susruta, I think you have studied Ashta Mahagada. In that, Ashmeri is one of the important disease according to Acharya Susruta. Acharya Charaga didn't mention Ashmeri, but Acharya Susruta mentioned Ashmeri as one of the Ashtamahagada, right? So, Ashmeri, it is a very important disease. So, you will be studying Ashmerija Mutrakrichra, giving importance, one among more importance in Mutrakrichra, that can be asked either for short essays. It can be come under like explain, enumerate Mutrakrichra, and explain Ashmerija Mutrakrichra, like that it can be asked. So moving on to Ashmerija Mutrakrichra, here mainly some of the important highlighted words, like which I have colored green and all, that has to be considered for priority. विशेषया बस्तिगदं सशुक्रं मूत्रं सपित्तं पवनं कफं वा यदा तदा अश्मरि उपजायते तु क्रमेण पित्तेषु इव रोजना go. So here what and all doshas, like as you studied in Kushta Saptodaka Dravya Sangra, similarly these are the some of the important constitution which is needed for formation of Ashmerija Mutrakrichra, like Sashukram, semen, Samutram, urine, Pitta, Kapha, and Vata also. So these are the things. Vada, aggravated Vada will be drying up the semen, urine, Pitta, and Kapha, which is located in the Basti. Bastigadam, Visheshayat Bastigadam, which is located in the Basti. The Vada, what does it do? It will be drying the semen, urine, and Pitta and Kapha. So there will be a stony like Ashmeri Ubajayade. So stone will be formed like gold stone in the cow. Rojana go. So go Rojana is the term which you have studied in which of the disease, like Mutrakrichra, Mutragata. So Rojana go is very important terminology which you need to think under Mutrakrichra, especially Ashmerija Mutrakrichra. So this sloga is important. Visheshayat Bastigadam sa Shukram Mutram sa Pittam Pavanam Kafam Va Yada Tada Ashmeri Ubajayade tu Kramena Pitteshu Iva Rojana go. So it can be classified into four: Vadaja, Pittaja, Kafaja, and Shukraja. So each one is having some specific like feature, like that we already told about the formation of development of Ashmeri, right? Like after this drying up of the semen, urine, pitta, and kapha by the Vada, there is a formation of Ashmeri stone. So the shape of the stone, or the color of the stone, or the feature of the stone is utilized for the classification of Vadaja, Pittaja, Shukraja, Kafaja and Shukraja. So in Vadaja, the stone which is formed will be like that of Kadamba Pushpagriti. Pittaja will be Ashma Tulya, like hard enough, like stone only. And Kafaja and Shukraja will be Slakshna and Mrudu. So these are the features which can be utilized for the differentiation of types of mutra, ashmarija, mutrakrichra. So if they ask like what are the type of ashmarija, mutrakrichra, four types of ashmarija, mutrakrichras are there. It is classified into Vadaja, Pittaja, Kafaja, Shukraja according to the Akriti or the similarities or the features formed in the stone. In Vadaja, Kadamba Pushpagriti, Pittaja, Ashmatulya, Kafaja and Shukraja, it will be Slakshna and Mrudu. Moving on to the clinical features. So after the former, so we have told what does it cause or what does it leads to ashmerija, mutrakrichra, we have discussed. So after that we told about the division of that vadaja, pittaja, kafaja and shukraja. So after that what we will have to study means we need to tell like how the patient will be explaining to us so that we can differentiate, yes, it is ashmerija, mutrakrichra. So these are the clinical features which you need to study clearly. Here मूत्रस्य च उन्मार्गमुपैति रुद्ध्वा मूत्रं रुजं तस्य करोति पस्तौ स सेवनी मेहनी बस्तिशूल विशीर्णधारं च करोति मूत्रम्. Here obstruction of the urinary passage takes place due to the ashmeri. Here even though it is mutra krutsra, here the word obstruction is used because of the formation of the stone. And pain in the urinary bladder, perineum, phallus and hypogastric region. So you know the 9 quadrants of abdomen. In that hypogastric area will be can be seen in as the clinical feature of ashmerija, mutra krichra. So here the main things which you need to study for ashmerija, mutra krichra is like vishirna daram cha karoti mutra. So here the normal flow of the urine in the urinary tract, here you can consider like this, right? So if at all any obstruction comes, what happens? I hope you can see the slide. Here the division of the flow or the stream is observed. So here the normal passage will be like this. So consider it as a urinary tract. So if at all there is a formation of a stone, the division of the stream will be there, thus causing the splitting of the urine while micturition. Vishirna daram cha karodi mutra. So this is the one of the important feature due to, and the pain how the patient will be expressing, like it will be agonizing pain and the patient squeezes his own penis like that, that much pain will be there. And frequently he will be frequently passes urine along with stool because that much pain will be there, so that he is forced to pass the stool also to relieve the pain. So he will be trying to relieve the pain. So in that struggle or due to agonizing pain, he will pass the stool also. Mritnadi medram satu vedanartho muhur chakran munyadi. So here he will, even though he passes urine, along with that stool also will be passed. And here along with the mutra, blood also will be there. Obviously we have studied due to the influence of those stones, there will be blood in the urine, and patient passes urine easily after eliminating the ashmeri. Tasya sugam mehate cha vyapata. So he will be having a relief of pain after the elimination of that stone. Similar to tamakashwasa you have studied, he will get relief when he sits in the sitting posture. Similarly, here after passing of that calculi, he will be feeling sukha. Moving on to Sharkaraja Mutra Krishna. So we have studied about the formation of the urinary calculi and the obstruction which is leading to the Krutsrada of the Mutra, etc. So here concept of Sharkaraja Mutra Krishna comes after that, because here the formed Ashmari will be disintegrated into small particles by vada again. So here main the culprit is vada only for the formation or the drying up of the semen, urine, kapha, pitta, and formation of the calculi. Also vada is the culprit. Again in the ashmari, to make it disintegrated like sand, so it will be that stone will be broken into a small particle like that of a sand, is also done by vada. And this, when it come out through the urinary tract, it is known as sharkaraja mutra krishna. So esha ashmari maruda abhinna murti syat sharkara mutra paschat sharanti. So here you need to consider that vada is the main dosha which is making the stone to get disintegrated. um, Again, in detail it is told like that processing of how the stone is getting to pieces, like how the ashmari is disintegrated. So first it is processing by the pitta, broken into pieces by vada, and separated into parts by kapha. So here all the doshas, it is the reference from Susruta Uttara 59th chapter. The influence of all the doshas is to be considered here. So the processing Pachyamana, so that the stone, complete formation of the stone is enhanced by the pitta. Paga of that stone is enhanced by the pitta, and the division or disintegration is done by vada, and the sleshma is helping it to get it separated. So then it will be coming out when we are voiding the urine, that is known as sharkaraja as mutra krishna. What are the clinical features you can anticipate from the patient who is having Sarkaraja Mutrakrishna? Hritpida, Vepadu, Shulam Kuksho, and so the patient will be telling about the all these type of pain, and Vakni also will be so Durbala and Murja, Mutra Gadascha Dharana. Actually, Sharkaraja Mutra Krishna is more severe than that of the Mutra Gada types. So, these are the clinical features you can highlight in case of Sharkaraja Mutra Krishna told by Acharya Susruta. Shakradaja Mutra Krishna. This reference is also from Susruta Uttara. Shakrudastu pradikhadat vayur vigunagadam atmanam cha sashulam cha mutra sangam karodihi. So here what happens means there is obstruction of urinary tract due to the distension of mm, rectum, distension of the rectum, and causing the obstruction of the urine outflow. And here also vayu vigunat, vayu is the dosha involved to cause the distension of the rectum, causing obstruction of the mutra vaha srotas. So it can be considered under constipation dysuria, wherein which in figure you can see. So this is the normal, and in abnormal there is a fecal mass, and thus leading to the pressure in the outflow of the urinary tract, obstructed urinary outflow, leading to difficulty in passing the urine and emptying the bladder. So passing the urine is also very difficult, and emptying the bladder. So after he started to pass, so there is a stoppage of the uh, flow due to again the pressure from the rectal canal. Contraction of the pelvic floor muscles occurs involuntarily due to the accumulation of the fecal matter, and the rectal distension of fecal can lead to the involuntary contraction of the pelvic floor. So the Shakradaja Mutrakrichra main dosha involved is Vada, and there is Atmana of rectum, thus causing obstruction. Mutra Sangha, thus causing the difficulty in passing of the urine. So Vada, Atmana, Mutra Sangha leading to Sashula, thus Mutra Krishna, Shakradaja Mutra Krishna correlated to, can be considered under constipational dysuria, wherein which the fecal matter is accumulated in the rectal canal, leading to the involuntary contraction of the pelvic floor muscle, leading to the making the patient to difficulty in emptying the bladder. So in this case, you can see some of the stool particles also in the urine, because due to this continuous accumulation or constipational dysuria, there can be the formation of fistula. There will be an abnormal canal formation, thus leading to the passage of the fecal matter through urinary canal also. So in some of the urine microscopy, you might have you, or you can see some of the fecal matter present in the urine sample due to the fistula formation over the time of constipational dysuria. As a part of constipational dysuria, there can be a formation of fistula leading to the presence of stool particles in the urine sample. So as I already told, we have covered Ashmarija Mutrakrichra. Some important points related to Ashmari from Nidana Sthana of Susruta, third chapter. I will just give a glimpse, because that is very important topic, because it comes under Ashtamahagada, this Kushta Ashmarya. So here Vadavyadi, this you have studied in first paper. Ashtamahagada, Ashmarya is one of the Ashtamahagada told by Acharya Susruta. So I will just give a glimpse of Ashmari Nidana from Susruta Nidana, third chapter. So Chadasru Ashmarya Bhavandi. So we have studied Ashmarija Mutrakrichra, also four, right? Vada, Pitta, Kapha and Shukra. So here he gave in the order of Sleshma, Vada, Pitta, Shukra. These are the four types of Ashmari. Chadasra Ashmarya Bhavanti. Sleshma Adhishtanam. So here he have given importance for Sleshma Adhishtanam. Tadyada Sleshmana Vadena Pittena Shukrena Chayedi. So main Nidana of Ashmari is very important. Tatra Samshodana Shilasya Abatyakarina Pragubida Sleshmaha Mutrasya Samprikto Anupravesya Basti Ashmari Janendi. So Asamshodana Shilasya, mainly the cleanliness of the patient, or apatya ahara vihara etc., will lead to the sleshma pragopita, leading to formation of ashmari in the bastisthana. And these are the Purva Rupa. So mainly Basti Gandhitva Mutredi is the Purva Rupa of Ashmari. I'm not giving much importance for this topic, because it is out of syllabus, but clinically it is very important, Ashmari. But we have studied that Ashmari under, so if at all, if you have, you can tell about the Ashmarija Mutrakrastra, again four types. सामान्य लक्षण of Ashmari is Gomedaka Pragasha Mityavilam Sasikata. So this is the Samanya Lakshana types again. So in there we have studied like Kadamba Pushpa, Ashmatulya, etc. Right? So here the types according to that Kafa Jashmari, Pitta Jashmari. Here he told about Kukkuda and Pradikasha, Ballada Gasti Pradima, Kadamba Pushpa here. So here also in Vadaja, he have given importance to the Kadamba Pushpa only, and Shukrashmari he have given related to the Shwaya, the whitish color he have given important. So in Kafaja Kukudanta, Baladagasti is for the Pitta, and Vadaja Ashmeri is Kadamba Pushpa. There also the types of Ashmerija Mutrakrichra, Vada, Pitta, Kapha, and Shukra. In Vada, Kadamba, Pushpa was the simile given. So these are the some of the regular pattern of oxalate or crystals we will be observing in the urine report. Calcium oxalate is the majority of the patient will be getting calcium oxalate 80 percentage, and it is radio opaque. So max it is when the patient is having urine as acidic urine, patients will be having most of the calcium oxalate. But in case of alkaline high pH patients, there will be the formation of calcium phosphate. So that is also radio opaque, but that color difference you can see, black or dark brown will be there in calcium oxalate. In case of calcium phosphate, it will be dirty white. In microscope you can see. And even uric acid, yellowish or reddish brown crystals are also seen. And struvite is also one of the important, and cysteine, xanthin. So according to the prevalent, calcium oxalate is having more importance. Moving on to urinary tract infection, which you can consider under Mutrakrichra, even though it is coming under common urinary diseases, some important points I will be highlighting that you can write if at all they ask for Mutrakrichra in general for 5 marks. So, urinary tract infection, you can write 2 to 3 points, like what is urinary tract infection and how it is divided, like upper urinary tract infection, lower urinary tract infection, and such things you can just highlight if at all they ask for 5 marks. So urinary tract infection is an infection that affects the part of the urinary tract. According to the area involved, it is divided into upper urinary tract and lower urinary tract. So cystitis and pyelonephritis is the word that you can consider for upper and lower urinary tract infection. And obviously, women are more prone to the UTI, because due to the anatomical reason, because men, considering men, females have shorter urethra, and it is closer to the anus in case of women. So these are the general causes. Obviously, why you need to know this means, when you are using what type of antibiotics, or what type of when you are doing culture of the urine. If you see E. coli or Staphylococcus aureus in specific Klebsiella, so it will be useful if you know exact uh, bacteria which is involved to select the antibiotics in case of modern. And even in Ayurveda, sensitivity study have proved, like E. coli, which kashaya you have to suggest considering the culture method. So apart from bacteria involved, even viral fungal infection is also very important to be considered. And intercourse and honeymoon cystitis, such terminologies comes under UTI only in case of causes. And pregnancy, in pregnancy also UTI is very common. And in case of male, due to chronic prostatitis, so from the back, so obviously we can tell urinary tract infection is retrograde progression, right? Because from the downward, so considering the bladder, so this is, we can consider the, so here you can consider the prostate gland. So from here it will get progress, right? So this is the lower urinary tract infection, and this you can when it leads to the kidney, it is upper urinary tract infection. So from here to it is moving to upward, so that is why it is called as retrograde progressive disease. So in case of chronic prostatitis, as the disease is chronic, obviously that patient will be having or he will be affected with UTI on and off, and like spinal cord injury, and in diabetes, and in children also, this urinary tract infection is very common due to the vasourethral reflex. And classification, as I already told, considering the upper and lower urinary tract, you can consider for cystitis and pyelonephritis. So these are the main two categories of signs and symptoms. Lower urinary tract infection, what will be the first priority of symptoms, and upper urinary tract infection, what will be the prior symptoms you need to consider. So if the patient starts with burning, with micturition, and urge to urinate, frequency, and absence of vaginal discharge, so these are the primary stage, right? So it didn't progress to the upper urinary tract infection. That's why it is in the preliminary stage only. These are the mild to severe symptoms only can be seen. But in case of upper urinary tract infection, there will be flank pain, fever, nausea, and vomiting. So these symptoms you need to consider for upper urinary tract infection, and you need to consider for uh, culture of the urine, so that you will get the exact cause of the disease. Symptoms in children. So in children they will be take intake will be less, and vomit and sleep more, and signs of jaundice and bacterial meningitis also may be there, and fever also can be there. In case of elderly person, there will be incontinence. So even though it is very less amount of urine, that will be not be under control, incontinence will be there, and sepsis, blood infection, and fever, chills will be there in case of elderly patient. So in your syllabus there is like clinical examination of UTI is as such the word very important. You need to consider physical clinical examination. Prior to that, these are the symptoms you need to you will get to know that you need to do a physical clinical examination for UTI. So fever, tachycardia, flank pain and costovertebral angle tenderness is very important, that I will show you in the upcoming slide. Along with abdominal tenderness, so which area you need to consider for anatomical 9 quadrants of abdomen, which area you need to give priority, and scrotal hematoma, metal discharge. So in male patient, so this is for male patient, for that there will be discharge from the penis other than that of sperm or urine. So there will be infection or pus like discharge will be there in case of male patient, and prostatic tenderness and inguinal adenopathy. So these are the main symptoms you need to consider for heading towards the clinical examination prior to lab investigation. So moving on to clinical examination, all you know about palpation, auscultation, percussion, and what palpation, auscultation, palpation, percussion, and inspection we did this. And moving on to palpation, you should confirm a thorough general physical examination. For that palpation, of which area, suprapubic area, you need to do palpation of the suprapubic area, and that bladder which contains more than 500 ml or more fluid, you can feel that. So it is palpable as in the suprapubic mass. So you can feel that mass if the bladder is having more than 500 ml, and the pain will be, the area you need to examine is suprapubic area. So clinical examination of UTI, inspection in general symptoms you can consider, and in palpation suprapubic area you need to consider. And moving on to auscultation. So auscultation here, you can consider mainly the costovertebral angle as shown in the figure. This is the costovertebral angles. There you can, if you feel the, if you keep the step, you can see there will be a brute sound, like audible, like vascular sound you can see. But all these cases are is like after chronic kidney disease or chronic urinary tract infection patient, you can get this auscultation and all, because due to the stenosis of the artery or aneurysm, such malformation can give you the auscultatory variation like broods in the costovertebral ankles. So palpation is over, auscultation, and after that percussion. Percussion, again the area is costovertebral ankles. So flank pain, as I already told, the flank pain you need to give important in case of elderly patient, and also in case of chronic urinary tract infection, flank pain, and costovertebral angle tenderness. So that this technique is Murphy's punch sign, wherein which the pain is elicited by the patient will be explaining about the pain when you do this percussion, because that area will be filled by the infected fluid, and that will be affecting the kidney surrounding that, leading to a pain during the tapping of the Murphy's punch sign. So the kidney produces pain due to the infected fluid is surrounded by the kidney. Gently you have to give like this percussion punch. This is called as Murphy's punch sign, elicited when gently tapping the areas of the back of overlying. You need to do it in the back of the patient, in the costovertebral angle area. And obviously you need to do thorough external genitalia area should be examined clearly, like regarding the penis, and about the any urethral meatus, like the surrounding areas around the penis, etc. Also the rectal examination, because you need to do per rectal examination so that you can examine the any abnormality of the bladder also, when you palpate in the upper aspect, and you can palpate prostate through rectal examination. If at all it is enlarged, you can suggest for a BPH PSA blood test, so that you will get to know whether the prostate is enlarged or it benign prostate, that hypertrophy condition is there, no. In that case you will get like tenderness, and enlarged prostate can be palpated by per rectum examination. So, moving on to the relevant investigations of UTI and its interpretation, like analyzing a urine sample. So, mainly urine routine. If you suggest urine routine, what and all things it comes, that you should know first. So, in that, physical, chemical, microscopical, as we already discussed, in that you need to consider these blood cells, red blood cells or bacteria presence of that. You need to do analyzing of urine sample in detail. Then only you will, if you see bacteria or microorganism, see in the microscope, you can go for culture. So after that you can sort out which bacteria is causing the disease. So according to that you can prescribe the medicine. And even the ultrasound, CT scan, and MRI can be used for creating images of the urinary tract. As I already told, if at all any in a long term or a long case of fistula can be formed in case of rectum, from rectum to urinary tract. So such cases can be elicited with the help of ultrasound. And even scope like cystoscopy can be used to see inside the bladder. Cystoscope is inserted to the urethra, and to see all the structure of the bladder or any obstruction, to elicit the obstruction etc. can be used. So
Mom.
these are the main. Hello.
Excuse me, mom. Mom, actually, the slides are not getting changed. Can you please check with the network again?
Oh my god. From where?
It's right now on the third slide.
Third slide. Now I reached almost 50th slide now.
Mom, can you just refresh it again? Or stop presenting and try to present it again. Yeah,
I
yes,
have
mom, it's
finished
visible. It's
almost.
visible now. Yes, ma'am, no problem, mom. You can continue.
But what about the slide then? I'm about to conclude actually. This is the last slide.
Yes, ma'am, you can continue. No, not a problem.
You just see the recording session. If any problem means I will do later.
Sure, mom. Sure, mom.
Okay, this is the culture for the urinary tract infection. This is the culture method. You have to drop in the culture media, wherein which there will be inoculating loop will be used for taking the urine, and you will be putting in the culture media in the petri dish, so that the colony can be differentiated along with the utilization of which drug. So you will be seeing a clear well if at all there is a good action of that medicine and it is killing that bacteria, means that drug can be selected. So this is the culture method. Maybe that is not that much important in your at this level, but you need to know that this culture technique is used for urinary tract infection to track which bacteria is involved, to get the correct treatment. So I hope it is clear. So we have discussed mainly regarding the Mutrakrichra. Then after that, importance of this topic, whether MCQ or short essay only, but no long essay will be there from this. And we have refreshed our knowledge regarding Mutravaha Srotas and all those features about Sroto Dushti and all the Pratyatma Lakshana, Hedu, Samprapti, and Vedas. And after that, importance of Ashmerija Mutrakrishna, along with the types, and thus how it is correlated with Ashmeri from Susruda's point of view, because Acharya Susruta consider Ashmeri as one of the Mahagada. And after that, Shakrudaja Mutrakrishna can be correlated with constipational dysuria. All these slides, which you can see in case of using microscope. And after that, we have discussed about the types of the stones, which exactly can be classified according to the prevalence, and urinary tract infection in general, and the cause and classification along with the signs and symptoms of lower and upper urinary tract infection. And main point is clinical examination of UTI, including inspection, palpation, percussion, and auscultation. Here, Murphy's punch sign is very important in case of percussion. You can't exclude the rectal examination too. And after that, we have discussed relevant investigations and interpretation. So, thank you. I thank this opportunity for, and I expect any doubts in this session.
Thank you, mom. Thank you for this wonderful session.